I'm Wayne Riggins. I'm from Jacksonville, Florida, and I'm an ophthalmologist. When I was 9 years old, we didn't really go to the doctor because we didn't have any money unless we really had a problem. And so I was having severe headaches, and so our family doc said, well, take him, get his eyes checked. And I still remember the first time I put on my first pair of glasses. He took me to the door, which looked out across the street at some trees. And I put the glasses on, and I could see the leaves on the trees for the first time. And I thought, holy cow, I didn't know you were supposed to see leaves that far away. And so after that, really truthfully, eyes, vision had always interested me. And from the day I considered doing anything professionally, it was always going to be an eye doctor. When I went to college, my family wasn't fortunate to have resources or education. My parents have GEDs. My grandparents were schooled not beyond about 6th, 7th, 8th grade. And, but they knew the value of an education. So I went to school on scholarships, and I worked. And when I got my first doctorate, actually, one of the ways I had to do it was I took a military scholarship. They had something called the Health Professional Scholarship Program. And I worked 3 part-time jobs. And so that's how I got through my first doctorate. And then I applied after that to the Military Medical Academy. And that's a situation where you go to something like their service academy for doctors, and then you have an obligation. So you're an officer when you go to school, and you train at Walter Reed and places like that. And then when you are done, your obligation is to give back a certain amount of time to the Army. When I finished at Walter Reed, they sent me here to Fort Bragg, and it was a similar funny experience. I got there, and basically the chief who was there said, here's the issues, tell me how it turns out. And for the first 4 months, I was the only ophthalmologist on Fort Bragg, the only active duty ophthalmologist taking care of 60,000 soldiers and their families. And so I was on call every day, 7 days a week for 4 months. And so I was fully occupied. So I was approached, and they said, we want to get refractive surgery done because people are getting lasers. And we're deployed in not very nice parts of the world sometimes. So contacts and glasses doesn't work well in the kind of work we do. But the Army didn't allow it, wouldn't allow it. Having gone to essentially the Service Academy for Healthcare, I had friends from the different services. It just so happened that one of my classmates from medical school was director of the new Navy program out on the West Coast, and they had their own lasers. So I rang him up, and I said, yo, we want to use your laser. And believe it or not, at that time it was not well received in certain circles in the Army brass at Walter Reed. And so I wrote a clinical protocol, largely crafted from the Navy's, and we established the first clinical research program. And we would actually fly those guys 10 at a time to use the Navy's laser on the West Coast, and we kept the data. And eventually that's how we got the program, the laser program, certified, approved, and the first laser in the United States Army was bought and placed at Fort Bragg. So we actually started the United States Army's refractive surgery program that way. In private practice, I still think that the most fun thing for me is just contributing to somebody's quality of life by fixing something that impaired their quality of life, like their vision. You know, I get folks that come in pretty routinely, and they say, you know, I've been wearing glasses since I was 5 years old. And since my cataract surgery, I only wear glasses for reading, or I may not wear glasses at all. For folks that have always had good vision, they probably underappreciate the value of that. A quick story that was, I never forget, when we were doing the refractive surgery program at Fort Bragg, I had a female surgeon, Colonel, and she was a patient of mine, and we lasered her, and of course she was overjoyed because she had had such thick glasses that when she went to the field, if you're on call in the field, you know, obviously people often get hurt at night because of the nature of what they do in the Army. And they'd yell "Doc," and she'd have to go. So she would, when she would take her contacts out, and she had really thick glasses, she would take her glasses and take surgeon's tape and tape them to her chest, so that as they called doctor, she could still see because it was in the tent at night, and she would rip her glasses off her chest and put them on. So that's a degree of disability and just general function that the average person with great vision doesn't have. So I still think it's fun to fix stuff like that. We have an obligation to do good things in the community. I mean, this is where we make our living. We live in a community where there isn't always a lot of resources for support in arts and education. And beyond that, I also feel like that it's one of our strong suits that we promote diversity. We live in a culturally diverse community. We not only believe that that's our strength, but we believe that we have an obligation to embrace it as a strength, promote it as a strength. And so what we do as a practice, the things that we support are organic to that particular philosophy. And really, truthfully, from my background, given our means, if it hadn't been for the fact that once we went on a school trip to see a play, and as a child I'd never seen a play before, outside of maybe something at church or something, but I'd never seen really a play. And it was an eye-opening experience. I'd never been to a museum until on a school bus we went to a museum. I think that that's the lovely thing. The mystery of life is how you open a young mind to something that it might not have been previously open to. And arts and education help connect the dots in the beautiful things about life, and help us sort of transcend sometimes the more meager, mundane aspects of day-to-day life. The true north, as far as I'm concerned, for us is always going to be to show up every day, work hard, do the best we can, and do it for the right reasons.